Hello everyone, welcome to our Medbridge YouTube channel. My name is Linoy. I'm a specialist doctor working in Germany. I'm an orthopedician and I'm the founder of Medbridge, established in 2020. Medbridge is a certified training institution and we support international doctors, especially from India, on their pathway into the German healthcare system. Through our doctorate program, we provide structured exam preparation, guidance through the German system, and long-term career integration. On the Medbridge YouTube channel, we regularly share real experiences, exam insights, and practical guidance for doctors planning Germany. If this topic is relevant for you, consider subscribing to our channel. In today's video, I'm speaking with Dr. Abhishek, who has successfully passed the Fachsprachprüfung or the medical language exam in Düsseldorf, and he is sharing his real life experience. So have fun with the video. So hello everyone. So we have it's weird for me itself. So I have multiple takes myself. Okay.
Yeah, it's okay. Don't worry. I'm a natural, so it's fine.
It's like
Yeah.
and then hello everyone.
Yeah. Like, hello, everyone. This is Dr. Joseph Linoy from Medbridge coming
I
at you
think
with.
I think we should include this part. I think we shouldn't cut it
Yeah,
out.
it gives it a bit depth and personality. Like, personally, if I was looking for a consulting company,
Mm,
and everybody is always so rigid. See, the kind of people who want to come to Germany are, I feel like people who are not who don't want to take the beaten path, right? Who want to do something different
yeah.
and that kind of stuff, and people with personality, and
I
depth.
thought I should take it out, but I'll keep it inside. So to
Yeah,
to give this thing a
it
real.
gives it a bit make it makes it a bit more interesting. They have to
Yeah,
know that you're
okay.
serious, but at the same time, it's not like
Yeah.
every other company. You have to.
I can't be formal, man. I'm sorry about that.
I think no, I
Yeah.
think that's your biggest strength, honestly. Like, you being casual with us makes us more comfortable and relaxed. So it's definitely one of your strengths.
Yeah, okay. So, okay, then we'll come to the point. Yeah. Okay.
Yeah.
So we have Dr. Abhishek over here. So Abhishek has done a great thing. So he had passed the medical language exam of Fachsprachprüfung in Düsseldorf. It was like day before yesterday. So congrats, Abhishek.
Thank you so much for your
So,
congratulations. Yeah.
so okay. So I'm doing actually doing this because I want to keep it on record because I need your experience on record about this medical language exam in Düsseldorf, how it was, and give like honest insights for the doctors who are planning to move to Germany. So we'll start. Okay.
Okay.
Yeah. So you can introduce yourself. So who are you? So
So,
where are you from? What do you do?
okay. So my name is Abhishek. I'm going to say Abhishek V because my last name is Venkata Subramanian, which is way too long.
Or a
And
foul, Abhishek Foul.
Fau. Yeah. I mean, yeah, I can go in German, but
No,
I
no,
don't think
we keep things in English.
English because for better
So
outreach, right?
the people who already actually speak German, so they know right how the things are. So
Yeah.
this is meant for people who are like
Uh,
thinking about Germany, who are
okay,
like
fine.
taking their baby steps. Maybe not even
Okay.
start with A1. So you need not show off your German skills. So
There
stick
is
to the
nothing to show
basics
off.
today.
There's nothing to show off. Honestly, my German skills are not like insanely
Yeah,
good.
but you passed the exam, so that means you yeah you should speak some German to pass the exam. So okay.
Yeah, I mean, yeah, definitely. I mean, it's very, very, very hard because it's one thing. See, medicine is already hard enough in English, and it's another thing to try to explain to the doctors why a patient has bone marrow suppression in German
Okay.
as a secondary to chemotherapy. So yes, it's a very big gap, and it's not really the normal German which you use on a day-to-day basis. So it's not something which you're really going to pick up unless you actually dedicate yourself to actually going and learning all these different terms. To be
Hmm.
honest, and yeah, so that was kind of wait. So who am I? I think I've told. So I mean,
Abhishek Fowl.
Abhishek Fao. Yeah, and yeah, and so basically, I finished my bachelor's in Savita Medical College from Chennai, And after that, I worked for 1 year in Manipal in Bangalore. And after that, I worked for 4 months in Apollo Clinic, and I worked for 1 year, 1.5 years in Sakra Hospital. And I always did have that thought that I really wanted to go abroad, but it was actually an option. Like after gathering all the options, at the end it came to UK, US, or Germany. And so the UK, I think everybody knows right now that there are way too many people in the UK, so it's going to be really hard to take that pathway. And
Yeah,
I can't
but
live
you
without
have a
work.
great CV, so you could have been someone who can actually crack the NEET PG and could have stayed in India, right?
Yeah, I mean, the thing is, the Indian medical system wasn't really for me. I don't know. I love working. I love working really, really hard. Like, I don't mind working 72-hour shifts, 48-hour shifts.
Mm.
But I feel like India, like, I think now it's going more towards a clinical oriented scenario. And nowadays they're asking more clinical oriented questions. But I think 3 to 4 years back, the kind of questions they ask is not really what we would see in our day-to-day practice. And that was also one of the big factors, which is why I decided for Germany, because it's more clinical oriented. Like a lot of the foreign countries, the exams are clinical oriented as opposed to studying something which is not really going to be what you see on a day-to-day basis. And also the working conditions are great over here. So I love working overtime, but I also like getting paid to work overtime, which is not
Okay.
really a concept in India. And
Yeah.
also hierarchy is always a huge thing in India. So, and I feel like over here, even while doing my hospitation, they were willing, the superiors are always willing to teach you and give you a lot of opportunities as long as you show engagement and you're showing like initiative and stuff like that. And it's not really like your superiors are not superiors. They're more like your friends if you show initiative over here. And they help
Yeah.
you and they take your time to teach you. And you can see that passion in them to teach you. And yeah, so I really love that part. And that's one thing which I didn't know before I came to Germany, but that's one thing I really loved during my hospitation is
Yeah,
that
that's this thing called Eigeninitiative
yeah,
or initiative. That
yeah,
thing doesn't exist in India. You have to learn that because in India, it is like, yeah, okay, you work hard and then things are given to you, but you have to take it yourself
yeah,
on it.
yeah, like
Like
over
Eigeninitiative, yeah.
Eigen and initiative, like if you work hard and you show you're willing to learn and you actually learn and show your knowledge, your superiors will take the time to actually develop you and cultivate you into a good doctor. And over here, things are very, very, very clinical oriented. Like apart from the like the dirty work which you have to, which is going to be there as long as you're a doctor, like documentation and all that stuff. Apart from that, if you actually go out of your way to like learn the cases and learn the different treatment methods, and you actually show this knowledge during your patient visitors, what we say, which is basically rounds,
Hmm.
they actually do take the time to show you. Like I got to saw like how do you interpret an EEG and stuff like that, and I saw really different cool things.
Okay.
So
So
yeah.
the thing is, so if you are planning to move to Germany, you have to learn the language. So that didn't like tamper with your decision to move to Germany. Mm.
So the thing is, I'll tell you one thing. Like, you know how they say that the brain is divided into, like, some people are extremely talented in math and science, and some people are more towards the linguistics and artistic sides of things. I'm a very math and science person, so I'll tell you straightforward that I am absolutely horrible at learning languages. Like,
Okay.
learning languages is really not my strong suit. And yes, it was something which I had to like look over and think, am I really willing to learn German? Because so let me put it out there that German is not an easy language to learn
Yeah.
for
Okay. Yeah.
sure.
That's a known fact.
That's a known fact. Yeah. So German is really not an easy language to learn,
But more and
but
more are jumping into this well. So I think it's
it's
the
manageable.
herd effect. Yeah.
It's the herd effect maybe, but if see, I'm a person who's horrible at languages, so if I can do it, you can do it too. Like, honestly, I am horrible at languages. I'm a very math and science person. So if I can learn German, I think anybody can learn German, to be honest. It's just a matter of putting the work into it because I really worked hard to learn German. Like, I learned it for 1.5 years. I used to go to full-time classes apart from working, and I also used to study in whatever small time I had.
Yeah.
So, and that is with work. So, if someone like me who is horrible at languages can learn German while working side by side, I think anybody can do it. And if you do have the support to not work and just fully dedicate yourself to German, it is very, very doable, I would say.
Okay. How long have you been in Germany? So after your arrival, so when did you come to Germany?
So I came to Germany in July, so it's been half a year by now.
Half a
So
year.
yeah, half a year.
So in half a year, you cracked your FSP,
Yeah, I did crack my FSP.
and in the first run, so usually there is a myth that the ones who take the exam in the first half of the year, they usually fail, but you didn't.
I mean, it's really because I really, really worked really hard to pass the FSP, to be honest. But I had a really good basis, like a really good foundation, because after I came here, I was enrolled in a C1 course, which
Hmm.
really helped in strengthening my language fundamentals. And then after that, I did a B2 C1 medical course, which was not too hard because I actually did C1, right?
Yeah.
And after the B2C1, I really studied hard for the last 2 to 3 months before my FSP appointment. And the thing is, because I had guidance, I didn't really have to worry. It's like,
I was
okay,
actually pushing you for the
uh,
FSB because you wanted like more time. So
yeah, I really wanted more time, but it's manageable, it's doable. But I really, really spent a lot of sleepless nights and burnt the midnight oil to pass the FSP on the first attempt. But I really did focus from the time I came here, and I did put effort into making German friends and speaking to everybody in German and watching my TV shows in German and listening to music in German. So I really immersed myself, and I also worked really, really hard because a lot of people say that the FSP is not a knowledge test, but I feel like the only reason I passed was because of the knowledge, because I studied a lot of all my topics side by side with
yeah,
Amboss
So I always say that. So you can't clearly differentiate Fachsprachprüfung from
from
Kenntnisprüfung because the
Kenntnisprüfung.
people
Yeah,
from the European Union they don't have a Kenntnisprüfung. All they have is the Fachsprachprüfung. So
Prüfung,
the
yeah,
time when we came, like in 2014, Fachsprachprüfung was that, like just testing the language. Can this person communicate medical German or not? But later on, it has become a stage where the European doctors, like from the other EU nations, they get tested for their medical knowledge too. So that's how this Fachsprachprüfung evolved to be a small
um,
Kenntnisprüfung as well.
yeah.
So
It's like a mini Kenntnisprüfung. I wouldn't
it's
say
a
it's
mini
as hard,
Kenntnisprüfung.
but it is hard. It is definitely hard.
Yeah. So I always say, how I always say, so you can't like clearly differentiate. So once you have learned the basics of history taking, you just have to start preparing for the KP, so direct. So
Yeah, yeah,
yeah,
that's definitely there. Like, so you have the
that should
first
be the
part.
rule. Like,
Yeah, yeah. So that's what. So it's like so the thing is, like, really what helped was, okay, so I really thought I failed the exam on the first attempt because what happened was, so people are like, so we can only take the patient history taking in 20 minutes. So first off, the Fachsprachprüfung is divided into three parts, right? So you have the history taking for the patient, you have the documentation, and a
mm,
telephone call from the laboratory, and then after that you have the last part, which is the Arztgespräch, which is basically a doctor-doctor kind of OSCE
yeah.
examination, is what I
Mm.
would say. So the thing is, in the first step, I was not actually able to finish taking all the patient history because my case was very complicated. It was basically myelosuppression, secondary to bone marrow injury because of chemotherapy for a malignant melanoma. So
Was this case in the protocols?
Yeah, so basically what happens is every year the Artsakama, that's the medical association,
Medical council.
the medical council, they add new cases every year. So it was there in the protocols. It's a protocol, but it's a case which was introduced last year. So it's
Mm.
not really. So the problem with the cases which have been introduced recently is we have no idea what kind of questions are going to come. Right,
Mm.
because we have a basic this thing like, okay, so they usually ask about the different types of malignant melanoma, but the thing is there's no fixed question pattern for the Fachsprachprüfung, which is a big problem because you don't have, like, us Indians, we're used to studying from a question bank and
Yeah.
knowing, okay, these are the kind of questions which can come,
But
but
here you need to go like
uh,
freestyle.
yeah,
You
you
need
have
to
to
be like
freestyle.
flexible in all directions. Yeah.
Yeah, you have to like be able to like be flexible and somehow, like, for example, one of the things was they asked me what are some drugs which could be used in chemotherapy.
Yeah. Okay.
I have no clue about chemotherapy. Okay, I will tell you that directly. Like, I have no idea what, like, okay, I have a few things in mind, but the thing is, like, so we also have a case for SLE, that is lupus.
Mm.
And what happened is we had to study a few chemotherapeutic agents for lupus because the treatment plan is also a very important part in the Fachsprachprüfung. So the thing is, I knew a few chemotherapeutic drugs from lupus, and then I
Yeah.
ended up telling those chemotherapeutic drugs for this thing because I knew those are also cytostatic, which is basic cytostatic drugs.
Mm.
And I ended up telling those drugs because, I mean, it's better to go all in and at least try to show that, okay, I do have some knowledge of cytostatic drugs than just be quiet and say, es tut mir leid, I'm sorry, but I don't know what drugs are used for chemotherapy. And thankfully, that ended up working. And I feel like a lot of questions, you should be flexible and use knowledge from other areas and try to answer the question. And the thing is, that's the thing, right? These are not simple questions. These are
Yeah.
questions which are kind of in depth, like in
Mm.
depth to the topic. So it's like, one, you have to be flexible. Two, you actually have to have some knowledge to answer these questions. It's not just purely saying, okay, a hip joint in German is this, our elbow joint is this. No, they can ask
Yeah.
anything and everything during the Prüfung.
And that was the Fachsprachprüfung like maybe like 12 or 13 years ago, where they were like, yeah, what do you say for a hip joint and what is like
Yeah,
diabetes mellitus in German.
yeah,
So no, the
German.
Fachsprachprüfung doesn't function like that anymore.
It doesn't function. It really doesn't.
It
It's
doesn't
big.
function anymore.
They've stepped up the level,
Yeah, they have
definitely.
stepped that level. So because they have people, yeah. So it's not like that they are really
They're
hardcore
not
and doctors.
starving
They
for
have doctors.
people.
Yeah,
Yeah, they're not starving for people. So the more people which are there, the more flexibility they have.
yeah.
And with the more flexibility they have, the more competition naturally
So
arises.
they can afford to fail a few.
A
So
few people here and there. So yeah, definitely it was hard. It was definitely
um,
hard.
so the moment you landed in Germany, so what was the hardest part?
So I would say the hardest part for me as an Indian obviously was the climate. That's the
Yeah,
first thing. Like,
but you landed in July, man.
yeah, I
It
landed
is
in
like the
July.
best weather.
It was good. It was good. But it's like the nights were cold. The nights were very cold. I found it cold,
Okay.
definitely. And also, like, I don't have a really good
But
cold
you're
tolerance.
you're from Bangalore, right?
Yeah, yes, I'm
It's
from Bangalore.
Bangalore weather. So
It's Bangalore weather, but it's a little bit more than Bangalore weather. But honestly, more than the weather, it was being in a new place and having a new start and having no clue what to do.
mm,
Like honestly, it felt that way in the beginning, but after like our weekly meetings and all that stuff, I got to meet other people from Medbridge, and I
mm,
got to make new friends and, yeah, contacts, friends, whatever you want to call them. But they really did give me like emotional support. Like, your family is always there for you, but it's only over the phone.
yeah.
And I had you, I had Nikhil and Nikita, I had Sahid, Gauri, Danya, and all these people. And a few of them also live in the same apartment as me. And being able to be there with them, hang out with them, and just talk to them was really helpful. Like, I feel like if Medbridge wasn't there, I would be feeling very isolated and lonely. But
Yeah.
that wasn't a
It gives
problem
you
for me.
some kind of network. Yeah.
Yeah, it gives you a network and people to support you and talk to you, and people who are going through the same thing as you.
Yeah.
So yeah, it's definitely there. The support network is there with Medbridge.
Okay. Okay. How long did you like intensively prepare for your medical language exam? So you did your medical
Yeah,
language course, and then we go through our weekly meetings. We do like case discussions, etc. Apart from
yeah.
that,
Yeah, so our medical, so we had our weekly discussions, but for the first 2 months, I was occupied with preparing for C1
yeah.
and my C1, just the speaking exam. Then after that, I had 2 months of the medical language course where I started preparing myself in terms of learning how to ask patient history
Mm,
and how to, because it's not only just a general history taking. Like, for example, you have a few ortho cases and neuro cases as well. So you have to know how to take history in these specific areas as well.
yeah.
And so I did start basing myself with taking history
Mm,
and learning some basic terms and everything. But I would be studying maybe 2 to 3 hours a day during that period, apart from classes. And
mm,
then after that, I did have a hospitation. So during the hospitation time, I kind of dedicated myself towards the hospitation.
yeah.
So I really immersed myself in spending a little bit more extra time over there, going through the patient documentation, seeing how things are done in Germany. But
Mm,
before my hospitation, I prepared intensively for 1 month. Like I would be
yeah.
studying around 14 hours a day, to be honest, for
Mm,
my Prüfung because I really wanted to ace the exam on my first attempt, right? And
okay.
then, so I did 1 month of intensive preparation before and 1 month of intensive preparation after my hospitation. But I would say that I also 1 month of light preparation during my, not 1 month, around 2 months of light preparation during my medical course. So all in
Okay.
all, 2 months of light preparation and 2 months of intense preparation, not counting the C1 preparation.
Okay. So did hospitation actually help for your
It
FSB?
of every like definitely it helped me a lot because so my hospitalization helped me learn. So the thing is, I know you can learn history taking, but what you actually learn and what you actually do with the patient is very different, right? Even in India as well, like, so what you learn and what is practice oriented are two completely different things. So I learned a lot of stuff. I learned, like, for example, 101 questions which I could ask in vertigo, but I did a neurology hospitation. So in neurology, we had a lot of vertigo cases, and I got to see the patient examination and how exactly do they take history for vertigo cases. And that helped me like cut out the extra meat, the wasteful meat, like it helped me
Mm,
learn, okay, this is actually what is there. And I got to see a lot of drugs and medication which they use, the brand names and the this thing actual components which are used for most patients, like anti hypertensive drugs, anti, so like, yeah, and so forth. So I got to see a lot of medications, and I got to see documentation, which is very important because documentation is a part of the exam as well. So I got to see documentation. I got to interact with my colleagues. I got to do patient rounds with my Oberarzt, that's basically my consultant, and I got to do a lot of things. So of every case, a hospitation is crucial for the
okay.
Fachsprachprüfung,
Yeah,
of course.
so my school is like okay, you have learned the basic medical things, and then you have to do the hospitation, and that's really crucial, and that's where you actually test your communication skills.
Yeah,
You can sit and learn however and how long you ever want, but unless you test yourself, you don't know what you're up to. So the moment the first day of your hospitation actually that puts you down, like, okay, so this is what I
yeah.
wasn't preparing for. Was it like that for you? So
Yeah,
this is not what I expected. Yeah.
yeah, like, so that's the thing, right? So the first day I come to my hospitation and I come with 101 different questions which I want to ask the patients and which I want to ask my consultant. And it's like I learned all this stuff, and then I come over here and then they're like speaking at this, like, they would put Eminem to shame, the way the how fast everybody speaks and how like how fast paced the hospital is. So I generally tend to speak really fast, and my German is also pretty fast. But there's a difference between speaking fast and being able to comprehend German really fast.
Mm.
And yeah, everything was really, really fast paced. And yeah, it felt that way in the first 1 week. I was like, I'm going to book flight tickets and go back to India. I was like, there is no way I can succeed. But like when you're stuck in a swimming pool, you eventually learn how to swim. And by like the second week, I start getting more comfortable, and by the third week, I'm like, yeah, I got this. I can definitely achieve this for sure. Like
Okay,
a
great, great.
hospitation really helped wire my brain towards working in a
Yeah.
hospital, and which
Mhm.
is basically what the FSP exam is for at the end of the day.
Okay, very good. So coming back to FSB in Düsseldorf, there's something weird in FSB in Düsseldorf. That's this lab call. So everyone
Yeah.
dreads over this lab call. So how did you manage that?
Okay, so the funny thing is, so the thing is, in one of our weekly meetings, we actually did electrolyte disturbances and blood gas analysis and everything.
Yeah.
So the thing is, I really didn't have to prepare extra for the FSP in terms of laboratory calls because I already
Mhm.
had all the knowledge because you already taught us all the symptoms, the complications, the treatment, everything. So I
Yeah.
already had everything. Like, so the toughest part is basically listening to the lab call, being able to listen to the patient's name, and knowing whether it's a sodium or potassium and how high the value is. But so the thing is, one part of my hospitation is I got to hear a few phone calls and I got to listen. So my assistant arts, like my colleagues, were really helpful. So they would
Mm.
put the phone on loudspeaker if I asked them, so that I could also hear how the lab calls exactly go. So I
Yeah.
had a fair idea of how the lab calls went, and I had the
Okay, you did
knowledge to
that.
back.
You did that really well. Yeah.
Yeah. So I got to see how I got to practice listening to lab calls in my
Mm.
hospitation, and I had the knowledge to back that up thanks to the Medbridge weekly meetings. So there wasn't really anything to stress out about, honestly, in terms of lab calls because all the building blocks were already there, to be
Okay.
honest.
Okay.
Yeah.
And the simulation patient or the actor patient, was it a he or she? Was she like cooperative? How was the person
So
like?
it was a she, and I feel like that was the one small mercy that the Fachsprachprüfung gave is that, okay, we're already giving you a screwed up case, so we might as well make the patient very cooperative.
Mm.
So the patient was really nice. She was very clear. She was very cooperative. But one problem is, so the history taking is extensive in this case because you have to ask a lot of things. Like, for example, how is the wound healing? And who is your chemotherapy? Like, when was the last cycle of chemotherapy? Like, blah, blah, blah. There's a lot of things to ask for. When
Yeah.
you're looking out for thrombocytopenia, anemia, you have to ask.
Could you finish the history taking in half an hour? That's the question.
So that's the thing. We have 20 minutes, and out of which 1 minute goes
Yeah.
because by the time you introduce yourself and the
Mm.
people who are there also introduce themselves, 1 minute goes. So technically speaking, you have only 90 minutes. And I could
Mm.
not finish my history taking. Like it is literally impossible. Like during my simulations, my mock simulations, which I did, I would try to finish the patient history taking in 10 minutes. Worst comes to worst,
Yeah.
it took me 15 minutes to finish my patient history taking because the thing is I was really thinking what kind of doctor do I want to be, and at the end of the day I thought for a patient who has cancer I think it's more important to rule out the complications than ask how much alcohol they drink in a day
Okay.
because it's not really the priority with such a patient. So I really took, I had like 5 minutes to finish like 70% of the history taking. And I did, I basically wrapped the history taking. Like, I was like, so how many cigarettes do you smoke? How much alcohol do you drink? Do you do drugs? No. Okay, good. Like,
Okay.
so that's basically me in the last 5 minutes. And I couldn't finish the social history taking, like what she does for work. And I
Yeah.
couldn't finish the patient uh, clarification. That's I
Mm.
couldn't finish explaining like what exactly do you want to do. So I couldn't
Okay.
finish the history taking. Like, yeah, definitely that was like a catastrophe. Yeah.
And
So
then you were taken to another room, right?
yeah.
To write the
So
history.
yeah, so I was taken to another room to write the history, but the problem is like, so again, it's just problem after problem, right? Because the patient also had difficulty in breathing, so I had to say, like, I had to document that the patient had no cardiac symptoms, and I had to document where the patient's
Mm.
oncologist, who's the patient's oncologist, where she's going for oncology treatment, when her last chemotherapy was, blah 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 blah, who's her house doctor, and stuff like that. So I had so much history taking, like, how's her wound healing? Does she have any infection? That like I generally did not like. So the thing is, people say that you have enough time in Dusseldorf to document because it's only points. Like
Point, yeah.
you don't have to write an answer brief, which is basically you have to write entire
That's in
sentences in other.
Münster.
That's in other places, right? But in Dusseldorf, you don't have that. But I
Mm.
found it hard. Like I was only able to document till the diagnosis. I couldn't write a differential. and I couldn't write a treatment as well because I ran out of time because I felt that like so the thing is I wanted to show create it like I was thinking in a hospital if I was in an emergency room what was more important. I was like okay, what's more important is documenting all the negative history taking so they wouldn't have to waste time checking for all this stuff as opposed to documenting that the differential and all this stuff. I thought okay, worst comes to worst, if they ask me why I didn't write the differential in therapy, I would clarify that in the third part to show that I
Mm.
had the knowledge. But I
Yeah.
felt that, and I also told them that I wasn't able to finish the documentation, although I did write as fast as I could. I felt that documenting all the negative history would save a lot of time with the wider treatment, like the treatment in the later stages, as opposed to, and you wouldn't have to struggle to ask who's the oncologist and stuff like that, because those details are important in a hospital. Like based on my hospitalization, I decided what to prioritize and what not to prioritize. And
Yeah.
I thought I could clarify all the treatment and all that stuff in the third part. So I kind of took a
Okay.
big gamble over there, but yeah, I it ended up working out at the end of the day.
Okay. And the examiners, how many of them were there?
So there were two examiners. They were middle-aged German men. Yeah.
Okay. Männlich weiß Deutsch. Okay. And from what subjects were they? What was their like specialties? Did they introduce themselves or?
No, they just
Yeah, they
asked.
didn't.
They were more interested in who I was, so they asked me for
Okay.
an introduction. They asked who I was and what I wanted to do and why I came to Germany. And I told them that, yeah, so I'm Abhishek. They actually laughed in the beginning and that kind of lightened the mood because they're like, we've been trying before you came here to pronounce your last name, and we
Uh,
weren't able to do it. And they're like, how do you pronounce your last name? And I'm like, you don't have to stress out about it because I'm not able to pronounce my last name properly either. And basically that kind of lightened the mood after that. And then they were like laughing and they
okay.
asked like, who are you? What do you want to do? Why did you come to Germany? And I'm like, my name's Abhishek. I'm a doctor. I worked in a nephrology department and I also worked in internal medicine. And after that, I kind of like, so I decided to come to Germany. So I learned my language side by side while working. So I kind of bought a few valuable minutes over there, I would say, in explaining all this
Yeah.
stuff. And they asked, why do you want to come to Germany? And I'm like, it's kind of the only place where I can do anesthesia and additional qualifications in emergency medicine as well as intensive medicine. Because in
Mm.
other places, countries, emergency medicine is a separate subject altogether. But in
Mm.
Germany, it's like an additional qualification. And they
Yeah.
actually spent some time to tell me, like, okay, so over here, it's an additional qualification. And it's
Um,
after.
I think that has made that should have made a difference in your exam because you were like really informed about the stuff that kind shows the kind of motivation you should be showing when coming to Germany. So most of them, it's like a place, okay, where you can move in without a NEET PG or entrance examination and get the
Yeah.
subject of your choice. That's not the whole deal. Yeah, so you should be
No.
knowing what you want, and you should have a goal in mind when you're coming to Germany, and that will make a difference in long term what you have. So because I have been seeing you, so you have been putting a lot of effort in learning German. So your German is like excellent. You can speak like really good, and that will make a difference long term. So these people who treat Germany as a second option because they couldn't get NEET and now they want to do some PG, and a person who has like clear goals on mind and who's like really invested in this thing, that will make a difference long term. Yeah.
Yeah, definitely. Like, so for people who think Germany is like a second option, it's not for them because honestly, one thing I understood after coming to Germany is if I put half this effort into NEET PG, I would have passed. Like, there is
Yeah.
no doubt in my mind that from learning German, I swear, like, so I did prepare for like 1 or 2 months for NEET PG in between, like after I finished
Mm.
my schooling. And my preparation for the Fachsprachprüfung was like hell compared to my preparation for the NEET PG
Yeah.
because it's one thing to so imagine having to study for NEET PG in German. That was basically the Fachsprachprüfung for me.
Mm.
And the thing is, because like Germany was always my first option. It was not my second, third, or fourth option. It's not because I failed the NEET PG or anything like that. I really like, I did the NEET PG for like, I did NEET PG preparation, but then I wanted to work. And it's
Mm.
after working that I figured out I do not want to stay in India. Like,
Mm.
I really, really do not want to stay in India. So after that, I figured out I don't want to stay in India. And I was like, okay, so where do I want to go? So I was thinking it's either US, UK, or Germany. But at the end of the day, I was like thinking, what do I really want to do in life? What do I want to specialize in? And that was also a big thing for me because I wanted, like, if a patient is collapsed on the road, or if I'm in a tough situation with no resources, I wanted to save that patient no matter what.
Mm.
And I feel like you for that you need procedural skills and knowledge. And I feel like the perfect marriage of that is no, anesthesia and emergency medicine.
Yeah. So
And
in that point, so I hate some doctors in Germany, so who have like migrated to Germany because they treat this as a second option. So they might have lived in Germany for around like 10 years, but I can't even articulate properly, not even use the correct grammar, and they have no idea what they're doing. So if you are not actually really going to invest yourself, put yourself out there, so
yeah,
there is like no use migrating to Germany
see,
because
there's a
you
yeah,
won't grow.
you won't grow. Like,
Grow.
so it's there's a very big difference. Like, even I've got to see, like, for example, I've got to meet a few doctors here and there who are actually finished with their Kenntnisprüfung, who are practicing in Germany, but who are
Mm.
not really integrated with Germany. There's a big difference between being a doctor in Germany and being integrated with Germany.
Yeah.
And I feel like if only you give it your all and you're passionate, you're like, I'm not here just to do a PG, I'm here to be a German. I want to be a part of the German community. I want
Mm.
to be and contribute and help the people. and
Yeah.
in order for you to have that mentality, you have to be passionate about actually integrating and being a German and learning the language and making German friends and doing
Yeah.
all that stuff. And all that was there for me because in my mind, so I really want to be like a German. I want to be a part of
You
this
should be able
country.
to speak like that. So,
Yeah, yeah, I
so
need to
I
speak.
always see on Instagram people saying like, yeah, okay, you can move to Germany and maybe start working there, but this higher managerial positions, they are like closed to foreigners. That's not actually entirely true.
That's absolute nonsense. It's just,
And that's just like wholly dependent on the level of your German language. So, are you invested in this thing or not? Yeah.
yeah,
So, in order to come forward to a higher managerial position, you need to be able to sit in board meetings and should be able to comprehend those stuff. Yeah, what
yeah,
these
you
people
have
are
to.
saying, you should be able to comprehend that, converse with them. So as long as you are not able to do that, you can forget about these higher managerial positions. Maybe in a doctor sense, it's like maybe a consultant post, or maybe in my setup, we're like a medical director or a site lead, such positions that will stay closed always. Yeah. So if you are like planning to move to Germany, so you have to be really invested in the language. So I always tell, so if you are planning to move to Germany, you need to learn German with those seriousness where you are studying for NEET. So you have to learn German
You
like
have
that.
to give it your all. It's not a
Yeah, you have to
hobby.
give it
It's not
all.
a side gig. It's this thing. And I feel like in compared to other places, Germany is a fair country. Like, honestly, if you put in the effort, you will see the reward.
Yeah.
That was definitely a thing. Like, I did not see any from the time I've come over here for the past 6 months. I have had only good experiences. I have not. I know racism is a thing, but I personally have not experienced any racism.
That comes
And
from this misunderstanding. If you don't speak the language, then I think the racism comes from
see,
not
it's
speaking
like
the
this,
German
right?
part. Yeah.
Like, if you come to India, if you come to Tamil Nadu, for example, and you don't speak Tamil, the locals are going to not like you. It's very simple. They're going to see you as an outsider no
That's
matter
good.
what.
That's good. Yeah.
And that's basically it. They have pride just like people, every other person from every other nation. And the thing is, I've made German friends, like actual German friends and everything. And because I'm able to speak in German. they've
Mm.
always been welcoming. I've always had a good time at parties and everything because I'm able to converse with them. Because they're not going to go out of their way to include you. So you have to go out of your way to be able to converse with them. And
Mm.
once you speak German, like I have never seen a door close just because I'm an Indian. Honestly,
Yeah,
like
that's
they
normal.
are more than happy to make you like let you be a part of their group as long as like you're able to speak because they're
I
not
have
going.
never had closed doors in Germany, so they were like, yeah, okay, I'm invested in this thing. Okay, they're like happy to give you whatever you want. Yeah,
They're more than happy to give, like, so that's the thing, right? I don't know about other countries, but over here in Germany, as long as you put in the work, you will see the reward, like a hundred
yeah.
percent. And that's like the
Mm.
best thing. Like Germany is a very nice capitalist country, and I adore that about Germany. As long
Yeah,
as you work your ass off, like you will get the reward. Like no matter what,
yeah,
there's no connections, nothing like that. Like if you put in the initiative, if you put in the work, you will see the reward. It's that simple,
yeah.
honestly. And I love Germany for that.
Mm-hmm. So you have passed your FSP or the medical language exam, so you have built your first buffer, yeah. That
Yeah.
means you have passed the stage one, so you are eligible to get your temporary license. I know it's quite difficult to get a job with a temporary license. So, what's your plan? So, are you planning to apply for jobs, or am I pushing you to take the
Uh,
KP?
no, definitely KP. So the thing is, I think one thing which everybody will agree with is once you stop studying and start working, it's very hard to get back into studying.
Yeah.
Like I know this personally for me, like I'm a workaholic. If I get a job, I mean, money is nice, but more money is better, honestly. And like there's I know with experience comes science, but the thing is, if you get a job after your temporary license, the work which you put does not count into your weiterbildung, your postgraduate
Yeah,
degree.
that's actually like a waste of time. Yeah.
It's a waste of time. I mean, you make money, so if you're not able to sustain yourself, then yes, getting a job and everything is a more logical option.
But it's like
But
putting in like 4 to 6 months. That's it.
yeah, it's only 46 months. Like one thing is I understood that I can pass the KP in 4 to 6 months, like side by side with the KP course, which I'm going to be doing right now with Medbridge.
Yeah.
And I know my personality, which is why I'm not going to start working because if I start working, the FSP was hell. Preparing for the FSP was hell.
Yeah.
Like honestly, I was drinking like 6 cups of coffee, sleeping like 4 to 5 hours a day, and studying I was studying like crazy for the past like 2 months. Like so I know that's the kind of effort which I want to be putting into the KP as well, so I can pass on the first attempt because there's not. I feel like there's not that much flexibility with the KP because it is only like 3 attempts if I'm not wrong. So
Yeah.
I don't want to waste a valuable attempt, and I want to pass it on the first attempt itself
You
because
have to
I
be
know
really bad. You have to be really bad not to pass like KP in the third attempt because you have to kill the patient, man. Yeah.
that's that's what. So the
You
thing
have
is
to
like,
kill the patient. So
yeah. So I want to pass it on the first attempt. In order to do that, I have to give it my all. And the thing is, I am in the headspace after the FSP where I can continue that same headspace and pass the KP. But if I
mm,
start working, I feel like my mindset will change, and I'll end up
yeah,
getting lazy.
you'll get stuck. So
And
you are out of this study mode. And
yeah,
then, so we always see that with the colleagues who have passed their Berufserlaubnis, if they pass the Fachsprachprüfung, have their temporary license, and they start working. And then you have your night shifts, you have your regular duties, and in the evening, you don't have that energy
to
or
study.
the
Yeah.
headspace to prepare for this exam. So it needs to go in one go if it can be done like that.
Yeah, definitely. That's one thing which I
That's what.
consider a good choice is to
Yeah.
go directly into KP as opposed to working.
Yeah, okay. So, in your journey till now, so is there something what you'd have done differently till now?
I would have started learning German in my MBBS.
Ah, okay. Okay.
Then I wouldn't have to waste time after my MBBS to sit and learn German while working side by side. It's not a time
Mm,
waste of time, but the sooner the better, right? I mean, the
yeah.
sooner the better. The more experience you have in your final destination, like in the final thing which you want to do, the better, right? And I did end up with. I personally feel this is not true for everyone, but I feel like I should have started earlier. like I should have
Mm.
started learning German during my MBBS and finished the C1 during my MBBS. So
Okay.
I could just directly, if I finished till C1 in my undergraduate studies, and I started my approbation application as well, like as soon as
Mm.
I finished, got my degree, then I could have come to Germany as soon as possible with the fresh knowledge from my MBBS and applied that in my passing
Okay.
everything fast. But
That's something people like realize like really late, and most of them want to try a NEET or something else for maybe 2, 3 times, and then afterwards they are like all drained for
yeah,
Germany, for India, for everything, for the humanity. So,
yeah, definitely, definitely.
so trying for NEET, it's quite draining. Yeah, it sucks the life. It sucks your life out. Yeah.
Yeah, I
Okay.
mean, NEET PG and FSP, it's all the same. So why not like work twice as hard and clear it and come to like and become a doctor in Germany? Then okay, I know some people are going to be hating on me saying no way, NEET PG is way harder. But as someone who's prepared for both of them, yeah,
Okay.
like FSP was hell. It was hell for 2 months. And it's another hell for 6 months. So that's 8 months. And that's basically the amount of time you need to prepare for NEET PG. So
Yeah.
yeah, so it is the same, except in this way, you're doing NEET PG preparation in German, and that's definitely not easy.
Okay. So I'll so in Germany the questions are direct. So
Yeah,
yeah. Okay. So I'll just put out this direct question. So do you think that Medbridge has really helped you out in your journey, or you think it was?
100%. 100%. Like this is not a glaze. This is not like some like he's not paying me or like any like the like nonsense like that. Honestly, from the bottom of my heart, Medbridge really helped me. Like I can say that with 100% confidence that Medbridge really helped me out.
Thank you. Thank you. So yeah. Okay. So what are your plans? So I asked you to take a 2 week break, right?
I think I'll cut it to like 4 or 5 days because I'm getting a little bit anxious.
No,
Like
no, no. Just
I know it's hard for me to relax because like randomly I'll wake up in the middle of the morning and I'll be like, what do I have to study today? And then I'll realize, oh wait, the exam is over and I'll
so
go
don't
back to
worry.
sleep.
So we have our plan. Yeah, we have our plan. And actually, you can ease off a bit till the mid of February because our course is starting mid-Feb. Yeah.
Okay, mid-Feb. Then I'll finish the 30 days plan from Amboss.
Yeah. Okay. Good. Just let out your steam a bit,
Yeah.
and yeah, then as a mid-Feb you can give like fall gas.
Yeah, for gas.
Yeah.
I mean, I wanted to set up a foundation for before I started the FSP course, no, the KP course. So I guess I can do that. I mean, the thing is for me, I just want to start working. I'm a workaholic. I've told that like 3, 4 times during this interview. So
Mm.
for me, like people have hobbies. I mean, I used to play video games before, but for me right now, medicine I know it sounds lame, but I really want to work, and there's nothing which would give me more joy than actually working in a German hospital after my seeing my hospitation and learning. Learning is something which I enjoy a lot. So for me, more than letting off steam, okay, I mean maybe 3, 4 days. I just want to get this over with, get the KP over with, and start working as an anesthetist. That's the biggest joy for me in life. But also, I did plan on going trekking and enjoying. One thing is Germany is beautiful. Like you will not see this kind of beauty. Like honestly, like I do plan on maybe going with some friends for trekking or something like that because the
Yeah.
nature and everything over here is excellent. And Germans are very big on physical activity and exercise and everything. So definitely do plan on going trekking or something or doing something apart from studying for the next 3 to 4 days. And then after that,
But it's cold outside. It's like high winter. So I don't think
uh,
there's much you can do outside right now because
uh,
we have the storm going on.
the thing
Polar
is,
storm. So
uh, in Germany, they have this saying, there's no such thing as bad weather,
yeah,
only
okay.
bad clothing.
Yeah, yeah,
So
yeah.
I'll just wear
All
like
right.
5 layers and go trekking, hopefully. We'll see, because I really like trekking and running. So hopefully I'll be able to somehow manage to go outside. We'll see.
Okay. Yeah. Yeah, then you can start gathering your layers for your next
Hmm.
trekking trip. So yeah, thank you for sharing your own words. Yeah.
Yeah, thank you too for
Okay.
taking
See
this
you soon.
interview.
Bye.
See you. Bye.
Thanks for watching. If this video helped you understand the Germany pathway better, subscribe to the Medbridge channel where we share real experiences, exam tips, and honest guidance for doctors planning Germany. You can also find us on Instagram at medbridge.de for regular updates and short insights. One important thing to clarify, Medbridge is not an agency or a consultancy. We are a certified training institution established in 2020. Our doctorate program, which is a structured certified training program for international doctors and for eligible candidates, this training can also form the basis for a visa to migrate to Germany. If you are seriously planning for Germany and want real preparation, not shortcuts, you can reach us at info@medbridge.de or directly via phone or WhatsApp. If Germany is your plan, Medbridge is the partner that actually prepares you for it. See you in the next video.